Hi, my name is Chizzy. I'm a senior clinical support worker with the NHS and I work in a busy and fast-paced cardiothoracic unit. My role in the ward is assisting patients with anything they need and assisting the qualified nursing staff. We try to make sure that the patient have the best possible experience while they are in the hospital. The patient is at the center of what we do. Their safety and well-being is our main priority. A typical shift for me starts from handover. You need to know the details of your patient and how to look after them. For instance, a patient who is very unstable on their feet would require a Zimmer frame or a Sarah study. We are assigned to teams and we basically know who is looking after whom. But that doesn't mean we can assist each other during the shift. At the end of the day, we are all here for the patient. We introduce ourselves and we gain consent of care. The patient gets to know you beyond your badge, so this is a good period to have a little chit-chat with your patient. In my role, competency and confidence is vital. You have to know when you can handle a situation and when to escalate it to a more senior staff. No two shifts are ever the same. You can be posted to a different unit today and another unit the next day. Today I am working in outpatient cardiology. The next day it could be respiratory or ambulatory day cases. I always come to work with I can do it attitude. You may be looking after a patient who is well and the next minute they are quite poorly. There's always need to work as a team to ensure that the shift runs smoothly and patients receive the best possible care. Some days you might be asked to take a patient to X-ray or scan or lung function test. It all depends. You should be able to know what to do in the case of an emergency. There's a lot of cleaning to be done as well, and infection control starts with hand hygiene and proper use and disposal of PPE. Assisted daily living such as shower bathing is one of the regular routines in the hospital. You can always make a difference to your patient by being respectful, being polite, and showing that you truly care. Some of the patients are very vulnerable. Any help you can render to them to make them feel better is worth so much. As a clinical support worker, you have to keep up with your mandatory training because people are relying on you. You must be good with numbers and have basic computer knowledge. A patient on a fluid balance chart requires you to be very accurate with your numbers and summations because any slight mistake could be dangerous. You should also be able to communicate effectively and in clear, understandable terms so that your patient can make decisions from an informed place. You have to involve patients and their families in the decisions made around their care. You also have to communicate very well with the multidisciplinary teams, including the physio, the speech and language therapy, and the radiographers. The registered nurses need to rely on you to pass information very quickly, as most cases are time sensitive. The most challenging part of the role could be the shift patterns. Sometimes it's very favorable, other times it's all clustered. But in all, I go home every day knowing that I put in my best and I've helped people to live a happier, healthier, and fairer lives. I'm not sure every job can give you that level of satisfaction. So for that, I'm very, very grateful. My name is Chizzy again. If you like this kind of content, like, subscribe, and share. And if you also want to know how I got this job from Nigeria, ask me in the comment section. Thank you.